Good morning. Hello, my name is Karen Bonner. I was really lucky. I knew really early on what I wanted to do with my life. I would become a nurse. And today, my career has far superseded my childhood aspirations, with over 25 years of experience behind me. These experiences, both positive and negative, have shaped me. And as a black senior nurse, I recognise the struggle that people of difference have in their leadership journey. On the 30th of March 2020, I began as chief nurse at Buckinghamshire Healthcare NHS Trust. At the time, I became one of 10 black, Asian or ethnic nurses working at executive level within the NHS. But I didn't know I was going to start my job at the beginning of a global pandemic. Nothing could quite prepare me or my colleagues for what we were about to face. Working in this profession comes with great privilege, but great responsibility. The demand on nurses and midwives is extraordinary, and as caregivers, we spend our time putting our patients first. The pandemic brought an increased risk to the public, but to healthcare workers alike, and many nurses and midwives didn't sign up to put their lives at risk in the name of the duty, but that's what they did. It was mentally demanding, it was physically demanding, working in the most challenging circumstances. I experienced a rollercoaster of emotions, both highs and lows. COVID-19 shone the light on the health inequalities, with disproportionate impact on black and Asian people. 10 weeks into my role, the worst imaginable thing happened. I lost one of my colleagues, a healthcare support worker, to COVID-19. He was being looked after in our intensive care unit by his colleagues. His name was Ture, and we felt that loss throughout the organisation as it sent shockwaves through our teams as we realised this virus had no boundaries. I too experienced a personal loss. A friend of mine died, he was 47, on the 7th of May 2020. I was heartbroken. We all were. Every day I'm saddened by the loss of life, and I'm reminded every day of the pain that every one of us have experienced. This heartbreak is felt so deeply by all of us during the pandemic, and it's a pain that we will never, ever forget. The responsibility for my team weighed really heavily, but it was standing shoulder to shoulder with my colleagues where we found our strengths. The COVID-19 pandemic brought out the best in health and social care staff. We all worked together, common purpose, going above and beyond. Individuals were outstanding in their practice, ready to serve as we fought off this unknown enemy. Today and every day, I am grateful for every one of my colleagues, both past and present, and the compassion they give. And I want to say thank you to all the courageous, tenacious, kind people that make the NHS what it is. Whatever we face, we can take pride in our strength in tackling every challenge as one.